My name's Kate, and I'm the National Sales Manager for SuneKOS UK. And I'd just like to welcome Dr. Rita Nandi, who is going to be doing the presentation on SuneKOS, particularly talking about the eye area today. We do have other webinars on YouTube that are available for all the kind of different treatments. So please visit our YouTube at MedEffects YouTube, which I can put in the chat as well for everybody. But I'm going to leave you with Rita now. Anyone that's got any questions throughout the webinar, please use either the chat box or the question and answers box, and I can go through those as we go along. And then at the end, Rita can take a few questions as well. So Rita, I'll let you take over. Go ahead.
Thank you so much. Can I just quickly check, Kate? Can you hear me okay?
Yes, I can hear you fine. Yeah.
Oh, amazing. Perfect. Okay. Right. Hello, everybody. How many people do we have on at the moment? 17, and probably it'll be going up in a moment as everybody jumps on. So thanks so much for, giving up your busy evenings leading up to Christmas, especially as well, to spend the evening with us, the next sort of half an hour, 45 minutes with us, as we talk about SuneKOS Performa and how it's so fantastic at specifically helping your patients who come in with eye concerns. So I'd say a huge majority of my patients come in complaining about something or other, related to eyes. So whether that's just crow's feet, or lines under the eyes where anti-wrinkle doesn't quite reach those lines, or dark circles, hollowing, eye bags, all that stuff that we always hear day in, day out. So also just another quick note is that you may have already seen the webinars that MedEffects has on their YouTube account. So sorry if you've already seen those, and today is a little bit repetitive. We will be covering a lot of the information that Dr. Mark Holmes covered in his webinar back in September, but we'll be focusing a bit more on how SuneKOS can help treat the eye area. So this is just a little bit about me. I've been a doctor for 15 years now. Gosh, where did the time go? So I got my CCT after qualifying as a GP back in 2015. I'm now a busy cosmetic doctor at a clinic I founded called the Bloom Clinic, which is in Canary Wharf, London. I'm also a senior injector working for Skin and have recently joined Derma Medical as a trainer. So alongside all of that, I'm also studying Harley Academy's Level 7 diploma and cosmetic dermatology, their combined course. And I'm really determined to get that finished by the end of next year, because it's been a few years now. So I need to get on with it. So talking about SuneKOS Performa today. So we've probably got a mix of practitioners in our audience today. Some of you are probably using it in clinic already or have some experience of it. Some of you might have maybe used it in the past, but not as much recently because of perhaps not getting the desired results, or you've just found some other treatments that you prefer using in clinic, and some of you might not have used it at all. So regardless of where you are with it, I hope you do find tonight useful. So most of you have probably heard of SuneKOS 200. This webinar will cover how the newest SuneKOS Performa can be used in place of SuneKOS 200 in their injection protocols, which it's worth mentioning have also been updated along with the launch of SuneKOS Performa this year. So SuneKOS Performa, like 200, is an injectable product which contains an upgraded, unique patented formula consisting of specific amino acids and low molecular weight hyaluronic acid. And I'll go through the talk later how the Performa is specifically different to the 200. So SuneKOS Performa, it can be used to improve the appearance of the skin of the face, the neck, the décolletage, the hands. So it's a super, super versatile product, guys. It stimulates production of new collagen and elastin, resulting in skin that looks plumper, it looks tighter, brighter, firmer, more hydrated. And then patients also say that they've noticed a reduction in the appearance of fine lines and wrinkles. And when treated in the under eye area, it leads to a reduction in the appearance of dark circles and eye bags. And what I think sets SuneKOS apart from some other treatments out there is that it can be used on risky areas like the forehead and around the eyes. And so it's a super versatile and safe product in my eyes, and that's why it's always my go-to skin booster, although it's not strictly a skin booster, but I know a lot of people refer to it as one. So SuneKOS focuses on the extracellular matrix, which is the part of the dermis which surrounds the cell, so it's the non-cellular part of the skin. It basically consists of a larger network of proteins, water, other molecules, that give structure to the cells of the body and help to nourish them. It also plays a crucial role in regulating cell behavior and helping them to function optimally. We say that aging in the skin happens when we don't have the ECM working optimally, and that happens mainly due to a reduction in the number and activity of fibroblasts, leading to less collagen, less elastin, as well as reduced hyaluronic acid, so there's also less hydration around. And as we know, hyaluronic acid, collagen, and elastin make a significant chunk of the ECM, and that's where SuneKOS comes in. So altogether, there's 28 different types of collagen now known. It's the main connective tissue protein within our body and makes up a whopping 25% of our total protein mass and 6% of our body weight. So it can be produced by all types of cells except for red blood cells, but mostly by fibroblasts, as we know. So collagen's made from a sequence of amino acids, most commonly glycine, proline, and hydroxyproline. And it has a crucial role, which is to provide that structure, that support, that strength that the connective tissue needs, and it helps to provide a sort of scaffolding for the extracellular matrix. Elastin, on the other hand, is what gives the skin its stretchability and its ability to snap back. Out of all the different types of collagen in the body, around 80% in the human dermis is type 1, and this gives the skin its strength. Around 20% of the dermis is type 3, and this gives it stretchability or distensibility. And collagen type 4 is where we're particularly interested because it's mainly found at the basal lamina level, which separates the epithelial tissues and the underlying connective tissue. And when we talk about the skin specifically, the basal lamina separates the bottom fifth layer of the epidermis and the dermis. So it plays a crucial role to anchor the epithelium to the underlying dermis tissue, and this leads to a skin tightening or firming effect. So that's where we're really interested. So if we look a little bit closer at this diagram at collagen type 4 now, you can see in the diagram that the yellow blocks are the epithelial cells and that the collagen type 4 is anchoring those fibrils formed by collagen type 7. And in doing so, it strengthens the attachment of the dermis to the attachment of the dermis to the overlying epidermis. So what's specifically great about SuneKOS Performa is that it promotes the formation of collagen type 4 in the skin, which, as we know, is harder for us to do naturally as we get older. So elastin is a protein that's able to stretch and contract without being damaged. It represents around 2% of the weight of the dermis and gives the skin its stretchability and is formed by precise amounts of the amino acids, proline, glycine, alanine, and valine. So you're probably wondering why we're talking about amino acids with the formation of collagen and elastin. And it's all relevant with the patented amino acid formula that's within SuneKOS Performa. So next up, we've got hyaluronic acid. So what is it? It's a polysaccharide formed from thousands of disaccharide units. Its action changes depending on the size of its molecules or its molecular weight. So low molecular weight HA is when HA is around 200 kilodaltons, and at this low weight, it regulates homeostasis within the dermis. It's also hydrophilic, so it attracts loads of water, and crucially, at a low molecular weight, it interacts with specific cell receptors on the fibroblasts, and in doing so, it stimulates them to produce collagen and elastin, so it helps with forming those structural elements of the dermis. It also has an immunomodulatory and anti-inflammatory effect, which I didn't know about before I did the SuneKOS training. So high molecular weight HA, on the other hand, is classed around 1,000 to 1,500 kilodaltons. And at this molecular weight, it acts as a protective antioxidant. So it protects those fibroblasts and the contents and the structures within the dermis by acting as a free radical scavenger. So that's the main difference between SuneKOS Performa, which contains 50 to 250 kilodalton of HA, and SuneKOS 1200, which contains, as the name suggests, 1200 kilodalton of molecular weight of hyaluronic acid. And so the two can be used together as they have different benefits when injected into the skin, and we'll confer protocols on how to use them in a short while. So here we have a diagram of young skin compared to old skin. So with age, the skin becomes thinner, as we know, and the reason for that is there is a reduction in the number of fibroblasts and an increase in the activity of enzymes which degrade collagen, elastin, and the hyaluronic acid, namely MMPs and hyaluronidase. So there's a decreased production of collagen, elastin, and HA. So the skin ends up being less firm, less elastic, less hydrated, just a bit lackluster and darker in appearance, particularly under the eyes. So these changes result in the skin becoming less resilient to the pull of the underlying muscles and the formation of lines and wrinkles. In SuneKOS's product developmental phase, known as the platform, they looked at human skin cells in their studies and firstly included all the essential amino acids. They then looked at and compared the gene expression of the cells when different combinations of amino acids were included to see which combination led to the greatest amounts of collagen and elastin being produced. So specifically, they were aiming to create the physiological ratio of collagen and elastin found naturally within the extracellular matrix. And during their studies, they actually did manage to find a formula of HA and specific amino acids to optimally restore collagen and elastin within the ECM. And this is what now has their international patent. The platform is just a term they've coined for the methodology that they use to develop their patented HY6AA formula, which can be found in many of their products. So what's in the SuneKOS Performa? It comes in a very generous 3.5 ml vial, so a little bit more than the SuneKOS 200, which I think was just slightly over 3 ml. And the SuneKOS Performa is different in that it comes pre-mixed, so there's no need to mix any vials and sort of faff around with that. So you save time. There's, you actually end up utilizing more of the product rather than leaving behind some of the HA that you need to mix into the powder in the previous 200 setup. So there's no need to mix any of the vials. So specifically, it consists of 35 milligram of low molecular weight HA ranging from between 50 to 250 kilodalton, and it also contains 128 milligrams of amino acids in total. And we'll explain a little bit later in terms of what the difference is between SuneKOS Performa and SuneKOS 200. In fact, we'll talk about it now. So the crucial difference is that the SuneKOS 200 contains 33.33 milligram per mil of amino acids, whereas SuneKOS Performa, what they did with the new formula is to increase the amount of amino acids to 37 milligram per mil. So it might seem like a very minor change, very insignificant, but actually the higher concentration of amino acids leads to a greater repelling effect on the action of hyaluronidase and breaking down the HA. And that's because the amino acids have a negative charge and they're hydrophobic. So as soon as hyaluronic acid is injected into the skin, what it triggers is after the water gets attracted to the HA molecules, that then triggers the action of hyaluronidase. And so the amino acid, the higher content in the SuneKOS Performa, causes a repellent effect. So it kind of staves off the action of hyaluronidase. And the studies actually found that this was for 40% longer, meaning that after the HA was injected, the hyaluronidase activity was reduced by 40%, meaning that those fibroblasts were activated for 40% longer, as well as 40% more HA action, the neoangiogenesis, the hydration, the anti-inflammatory action, the antioxidant action, and all the benefits that HA has in the skin, which ends up leading to more effective results. A clinical evaluation of the Performa using a pinching test showed that it brought about better skin elasticity, and during their Visier skin analysis of their patients, it was also shown to improve the appearance of wrinkles. Specifically, there was a 44% reduction in periocular wrinkles and a 71% reduction in forehead wrinkles. And it also managed to show a reduction in redness and dyschromia, which was related to photoaging. So now what's great is that these improvements have been shown clinically to last for up to 6 months after a course of SuneKOS Performa. So when you treat your patients with a course, they'll get a good while out of it. So you won't need to bring them back until 6 months after, not baseline, but the last treatment treatment session. You then bring them back, and in my experience, my patients don't always need a session at the 6 month mark. I sort of, maybe can do one as maintenance, but then actually a lot of them have fed back that their results have lasted a lot longer. So even 7 or 8 months after the last treatment session as part of their previous course. So I think my patients get better results than what the studies have shown in terms of longevity. So In this ongoing study, we've got 15 female patients who are aged between 40 to 67, who've all had 4 sessions of SuneKOS Performa, with each session spaced 10 days apart. And the Visio and vector images shown here show a 40% reduction in redness in the top left image and a 49% reduction in dyschromia on the bottom left. And the images in the middle show a 71% reduction in wrinkles in the forehead and a 44% reduction in wrinkles around the eyes. So what can we use SuneKOS Performa for? We can use it on a whole host of areas where we want to improve the skin elasticity, the firmness, the general quality of the skin. And it is a super versatile product, so we can use it over the face, including around the eyes, the forehead, as well as the troublesome upper lip area for smokers' lines, for example. It can also be used on the neck, the hands, the décolleté. So I personally tend to use a lot of it around the eyes, in fact, more than anywhere else, and have been getting great results. And most importantly, really happy patients who then recommend the treatment to friends and family, as they've been so happy with their results. And the kind of patient I tend to use it on is really varied, actually, young and old, so across the board. So I can use it on its own if someone just has fine lines or pigmentation, or in patients who are unsuitable for tear trough filler. So maybe the slightly older patient who they're at higher risk to complications, or if they've got eye bags. And they're just really grateful that I'm able to offer them something in clinic. So if I offer SuneKOS as a potential treatment option, it'll improve their under eye area. They'll be grateful that you've done something to directly tackle this area, instead of saying, no, we can't treat the eyes directly. And then, you know, sort of suggesting things like cheek filler and things like that, which they might not necessarily want to do. So I do use it in combination a lot with tear trough filler, especially when there's hollowing as well as pigmentation or fine lines. And I've found that I've had superior results than when using tear trough filler on its own. So I tend to use that together a lot as a combination, or I do just treat it on its own, just use the SuneKOS on its own for a lot of my patients as well. So what I do is I make sure I put the numbing cream on for around 10 minutes as a minimum, 10 to 15 minutes usually. And then once the numbing cream's on, give it a good wipe, give the face a good clean. And then the actual injections take only around a couple of minutes per area that you're treating. So it's super quick, it's really easy to inject, it's got a low resistance, so you can move quite quickly across the face. And we know that quicker injections are sort of less painful. So most of our patients tell me the pain's tolerable. As long as you've left the numbing cream for long enough, you know, they're fine. They say, oh, it just pinches a little bit, but generally I get patients who say that, you know, they'd get it again. It wouldn't put them off, the pain wouldn't put them off having it again. So immediately after the treatment, it's worth noting that the patient does look a little bit blotchy, a little bit red, a little bit swollen, especially if you're treating around the eyes. So it's just important to reassure them to say, look, it all tends to resolve after a few hours. I have had a small minority of people who have had their eyes treated and have had some mild residual swelling lasting for a few days, and even one lady where it lasted sort of a week and a half, but it wasn't anything major. She still was able to go into work and things like that, but she just had very, very minor swelling that just lasted a little bit longer than expected. So I advised her to do some facial massage just to help encourage that drainage of the area, just to minimize the edema, the swelling a little bit quicker. But that's not common in my experience. Most patients resolve within a few hours. It's very little downtime. Also, I think it's interesting to say that so far there haven't been any cases of vascular occlusion while using SuneKOS, but they do say never say never. So as long as you're injecting safely, following the protocols, we wouldn't expect you to be running into any problems with vascular occlusion. So when using the SuneKOS Performa face protocol, you inject the SuneKOS 1200 first, which comes as a 3 ml vial. So that doesn't come pre-mixed. You have to transfer the HA into the amino acid powder, not the powder, sorry, the liquid. So using either a needle or a cannula, followed by so you can use the SuneKOS 1200 with a needle or a cannula, and then you use the SuneKOS Performa straight after. So the rationale behind injecting SuneKOS 1200 first is that the high kilodalton of HA, which we mentioned earlier, was acting like a free radical scavenger, protects those fibroblasts and the dermis. So you inject that first, and then the Performa is injected straight after. And the combination of the Performa along with the SuneKOS 1200 is thought to activate the new collagen and elastin production in that first session. And as you can see on the screen, 2 weeks after, we bring the patient back and do the second Performa, which is when the collagen and the elastin start to strengthen the extracellular matrix. And then the third Performa is done 2 weeks after, which then sets the effect, so the effects last up to 6 months. And then the fourth session listed on the slide is optional in patients who have more severe signs of aging. So hopefully not many of your patients will need that, but just to kind of give them that flexibility with the protocol. So just as a quick summary, the SuneKOS 1200, it can be injected using a cannula or a needle, and only into the mid-face or lower face or hands, and importantly, not into the forehead, nose or neck, because it's just a little bit too thick in consistency to be injected into these areas. And the SuneKOS Performa can be injected using a needle only, using their proprietary high performance technique, which I'll be referring to in the next few slides. So these patterns that you can see on the images here, they're called Langer's lines. So in terms of the SuneKOS injection protocols, you'll be seeing these patterns over the face and the body over the upcoming slides. And these folding lines were discovered by an Austrian doctor called Karl Langer in the 19th century, who hypothesized that the distribution of our bones, our tissues, our muscles, all apply a certain tension on the skin in various places, which predisposes it to form wrinkles in a certain way, in a predictable way. So the new protocols for using SuneKOS, whether that be SuneKOS Performa, SuneKOS 1200, and then newer products recently launched on the market, so they're SuneKOS Cell and SuneKOS Body, which you may have heard of, use these folding lines by placing injection points perpendicular to these lines to help support them and build collagen and elastin across these folding lines. So when you see the diagrams of the injection patterns on the next few slides, you'll notice how the injection points go across these folding lines, just to kind of mention it. So for the SuneKOS 1200 technique with needle, you can see here on the lady, she's got the Langer lines demonstrated. So when you're using SuneKOS 1200 with a needle, the blue points are the priority points and the yellow points are only optional. So 0.3 ml is injected into each point, whether that's the blue or the yellow. So you can use a standard 30 gauge 13mm needle to inject the product. You can use a 1 ml syringe, so you can be more accurate with measuring out those 0.3 ml boluses. And the target of the injection is the medium to deep dermis. So this next slide shows where to use a cannula when using SuneKOS 1200. You can see the areas where the entry points are denoted by the red dots, and the red arrows is the direction of the cannula insertion. And if we look at the next slide, we can now talk about the high performance technique of SuneKOS Performa. So when treating the eyes, this is why we're sort of focusing more on the high performance technique, because when treating the eyes, you don't use SuneKOS 1200. That was just a really quick kind of recap on what SuneKOS 1200 is for and how you use it. But let's now focus a little bit more on the high performance technique. So on this slide, you can see that this lady is being treated with the high performance technique in her mid and her lower face. So there are different ways to treat the face using SuneKOS Performa. For example, you could choose to just treat the forehead and eyes, or just the mid and lower face. And that's the great thing about the product, as it's really versatile. You can make it bespoke to the patient's needs. So for example, if they have problem areas of smile lines or fine creepy lines around their mouth, chin, lower face, and their smoker's lines, then you can just treat the whole vial, 3.5 ml vial, on these problem areas. But on this slide, you've got that protocol for treating the mid and the lower face. So you can see the dots denote where to do the injection points and how much. So those little purple dots you can see around the eyes and the smoker's lines, you'll probably notice that there's 10 purple dots. So it's 0.03 ml per point and roughly 0.3 ml total per area. So 0.3 ml around the eyes, or 0.3 ml in total around the smoker's lines area per side. So 0.03 ml per bolus. If we move on to the next slide, it shows you a different pattern of treating the face. So specifically the full face, so going a little bit in the mid face, the lower face, the chin, and also the forehead. So the forehead, you can actually get away with injecting 0.1 ml per bolus. Some practitioners might feel a little bit uncomfortable injecting big boluses into the forehead like that. So you can actually use a cannula in the forehead if that makes you feel more comfortable. So this is just quickly recapping the neck and the décolleté. So you've got the high performance technique, which covers neck and décolleté. Patients usually need 3 treatment sessions here, spaced 2 weeks apart, with an optional 4th session for your more severe sort of signs of aging cases. So now let's focus in on the eye area. So as mentioned on a previous slide, with age, our skin becomes thinner. There's a decreased production of collagen, elastin, HA, so the skin ends up being less firm, less elastic, less hydrated, and more wrinkly. So the skin under the eye is one of the thinnest areas of skin on the body, and it has very little or no subcutaneous fat. So as we age, the midface collapses, it falls away, the dark muscle and the vessels within the skin become more visible in the under eye area, and these vessels become more leaky, causing breakdown products of hemoglobin like hemosiderin to be deposited within the skin, and this leads to visible pigmentation in the skin. So that there's many other factors which can cause dark circles, such as genetics, so certain ethnicities are more prone to dark circles. Medical conditions like eczema can lead to dark circles as a result of inflammation, and even certain medications can contribute to the appearance of dark circles too. So when patients come in complaining about fine lines around their eyes, dark circles and eye bags, you can offer them SuneKOS as a possible treatment option. And so when you're treating the eye area specifically, because the vial comes as a very generous 3.5 ml, we wouldn't suggest using the whole amount in the eye area because that would be way too much. So instead, to not use any more than around 1 ml for each eye. So you make sure that you stay lateral to the mid-pupillary line. And after this, you're after treating the eyes with numerous tiny boluses of 0.03 ml. Again, the needle is very sort of very parallel to the skin because you want to stay superficial. The skin is thinner here, so you don't need to go as deep or as steep with your needle in this area. So once you do those little blebs of 0.03 ml at each of those sites, you're then left with approximately 1.5 ml if you end up using 1 ml per side per eye. You can then place a small optional 0.05 ml bolus at the tail of the brow, and then place the 0.1 ml boluses into the forehead area, as shown on the diagram, or even use it on another area of the face. So for example, if the patient says their SuneKOS lines is a problem area, you can then use it there. So that's a fantastic thing about these protocols. You don't have to sort of go by them as Bible. You can play with them, you can change them slightly and just make it more bespoke to your patient, and they'll be happier for it. So after treating my patients with just 1 treatment session to the eye area, they usually notice an improvement after just the 1 session. But obviously, we have to encourage the patients that they will get the best results if they go for the full course. So the reason why the SuneKOS Performa helps to improve the under eye area so well is because obviously you have the hydration effect, which is in the first couple of days. This is why the patient will sort of message you to say, yes, I've noticed a really dramatic lightening of my under eye area. It just looks fantastic, a lot less dark in appearance. But then over the course of the treatment and over the subsequent month or so, you then get new extracellular matrix being produced, and that has actually been clinically shown to thicken the skin under the eye over time. And it also increases the elasticity, and that's why you get the longer term effect of the reduction in the appearance of dark circles and eye bags. So I just wanted to take this opportunity to ask if anybody had any questions regarding the eye area, because that's what we're covering today in a bit more detail. There's something that's come up in there. Oh no, that's Kate Harris's message. So can I just give you guys a chance to maybe pop some questions on if you have any to ask at the moment, or we can just save them at the end, whatever you prefer.
Rita, I can't see the question and answers, so you might have to just keep track of that one.
Oh, right, okay. I can see it and I can't see any questions so far, so I'll just get rid of this then. Let me just quickly check. Yeah, I don't think anybody's popped any questions on yet. Okay. So if we just move on to the next slide now. Whoops. Sorry. Okay. So this is a before and after, not a patient I've treated in clinic. This is it's owned by Professional Dietetics. I'm not sure who the practitioner was, but you can see this lady, the 37-year-old lady who's had 2 sessions, and this is her before picture on the left. And you can, I think you'll all agree that she's had a significant improvement in her under eye appearance on the right there. I don't know how many weeks after the second session the photo on the right was taken, but pretty impressive there. And then if we look at some more before and afters, we've got a 49-year-old lady on the left and a 57-year-old lady on the right, and they've also had sessions of SuneKOS to their under eye area. And you can see the lady on the left, the elasticity of the skin. We can't obviously assess elasticity by just looking at it, but it's sort of looking a bit more firm, the skin under the eye, and it's less baggy. And then you've got the lady on the right, and she seems to have a reduction in the appearance of her sort of fine lines under her eyes. And now I'm just going to talk you through some patients who I've treated in clinic. So this next lady, she's fairly young, in her late 20s. And so she complained of dark circles, colouring as well. So I actually treated her with tear trough filler. And so the picture at the top is after her tear trough filler, but you can see that the pigmentation is still sort of, the dark circle appearance is still there a little bit. It had improved a little bit after the tear trough filler, but it was still there. And so the picture below is after 3 sessions of SuneKOS Performa to her under eye area. And the picture was taken approximately 1 or 2 weeks after her 3rd session. The next lady, she again is sort of late 20s, early 30s, and she came in complaining of dark circles. So that was just after 1 session of Performa, which blew me away, because even she was incredibly excited about her results, and she couldn't quite believe that she had such an improvement after just 1 session. So altogether, she was treated with 2 sessions, but this was her after just 1 session of Performa. Now, these next 2 are really interesting, because these ladies were coming in complaining of eye bags. They wanted me to help reduce their appearance of their eye bags. And so this lady, she's in her late 50s, and she had quite noticeable eye bags in the top picture there. So no other treatment with me apart from 2 sessions of Performa. So the picture on the bottom is the appearance of her eye bags after 2 sessions. And I think it was taken about 2 weeks after her 2nd session. I actually ended up treating her with a 3rd, but I don't have her afters after that 3rd session. And this next lady, she's in her 60s. So she came in complaining of, those sort of eye bags as well. And she wanted to reduce the appearance of them. So I treated her with a total of 2 sessions of Performa. And then the picture on the bottom was taken about 3 weeks after her 2nd session. And those ladies who had the problem of eye bags, they were really, really happy with their results, and they'd noticed an improvement in their eye area. So we're just coming towards the end now. So just a real quick kind of webinar covering the eye area, covering SuneKOS in general, just covering some of the basics. And if anybody has any questions, feel free to just pop them in the Q&A bit. Okay, I can see them now. So somebody's messaged, can you treat the eye area with cannula? That's a really good question, actually, because Dr. Mark Holmes, he uses cannula a lot when treating patients in the eye area, because it doesn't cause as much pain, it doesn't cause as much bruising. That is something that I have had to master, so try to sort of reduce the risk of patients bruising. That's probably the biggest complaint that they were giving me, because obviously with all those little needle injections going into the skin, there's a good chance of causing 1 or 2 bruises there. I have had some patients who have had more noticeable bruising. I've had some patients who have had no bruises. So again, it's just all about kind of avoiding vessels where you can see them, but sometimes this isn't always possible to avoid bruising. But yeah, I know that Dr. Mark Holmes uses cannula a lot for the eye area. I personally haven't tried this myself, but I have just used the needle. And I think most of my patients who have had the treatment with me have been pretty happy to sort of just risk the small bruising risk and get the results that they've got in clinic. But you can treat the eye area with cannula. Sorry, that was a bit of a long-winded answer. So not sure if it's already been answered, but does it cause any puffiness if patient is prone to this under their eyes? Yes, I would say in my experience it does. So, sometimes you can predict who's going to have a little bit of puffiness. Say if they wake up in the morning with puffy eyes, or they've had puffiness after other hyaluronic acid treatments have been injected around their eyes, so they would be at a higher risk. So just kind of giving them the heads up and saying, look, if you plan to have this treatment in clinic, maybe just consider what kind of downtime you'd need. For example, do you have any important work meetings coming up in the next few weeks, or any important social commitments, weddings, parties, anything like that? So usually they'll sort of slot the treatment in at a time in the diary that suits them, where they can sort of factor that in, that they might need to have a little bit more downtime for that prolonged swelling that they might have. How does it work on both tear trough or game tightening plus bag above? Sorry, I don't know. Meti, would you mind? Oh, okay, you've just said question now answered. Okay, fantastic. And then if we move down, so sorry, I missed the injection depth. Could you please repeat for me? And how frequently do you swap your needle? That's a really good question. So in terms of the injection depth, you're aiming for the mid to deep dermis. So usually that means if you're using a 30 gauge, 30 millimeter needle, that you're sort of injecting at a approximately 30° to 45° angle in terms of the steepness, if that's a word, of the needle. You then put in approximately a third of that 30 millimeter needle within the skin. Obviously that varies from patient to patient depending on the skin thickness, their body habitus, etc. So, you know, that's what I tend to do. And if you're sort of having no resistance at all when you're injecting, it might be that you've gone a little bit deeper into the subcutaneous layer and that you don't have any resistance there. So, you know, just pull the needle back a bit and then you should have some resistance, some slight resistance, and that will indicate that you're in the right layer. If you have far too much resistance and you can see the grey of the needle, then you've come a little bit too superficial, you're in the epidermis. In terms of how frequently you swap the needle, I would say, you know, sort of, there's no set thing. So, you know, as soon as you feel that needle struggling to pierce the skin, you can then just get some 30 gauge needles on standby and then just, you know, pop them on whenever you're feeling the need to swap them. Also, it's less painful for the patient if you change them frequently. So somebody else has asked a question. I work in an area with a high population of South Asians. A common complaint is dark circles. Would this treatment be appropriate for genetic dark circles? Yes, absolutely. A resounding yes. I treat so many patients who are of South Asian ethnicity, and they have had it for all their life. They say it's passed down from their parents, or, you know, their parents have exactly the same thing, their grandparents have exactly the same thing, and they get amazing results. And a few of my patients have had results go far beyond the 6 month, which is what the clinical studies have shown. So they come back to me sort of at the 9 month mark or 10 month mark, believe it or not, for another sort of top up session. Let me just scroll down. So 2 questions, please. Should product be massaged after injection? Can this be used to benefit upper lid hoodedness? In terms of massage, I know that was definitely encouraged in the older protocols. So before the newer protocols were introduced that you've just seen on the slides. So massage isn't mandatory. It was encouraged in the last one, but I'd say, I personally massage my patients because it just helps to spread the product a little bit more under the skin. And in terms of massaging, you massage towards the flow of the interstitial fluid. I think the reason why it was taken off the most up-to-date protocols is because they didn't want to overcomplicate the protocol. So not everybody knew what the flow of the interstitial fluid was, and they just didn't want people to sort of panic or worry about doing it wrong or anything like that. So you can massage if you want to, and I personally massage my patients after I inject. Can SuneKOS be used to benefit upper lid hoodedness? I don't think so, no. So upper lid heaviness, that would warrant other treatment options. So SuneKOS won't be able to help with this, unfortunately. So I don't think we have any other questions. Because it's quite a small group of us, feel free to take your microphones off if you want to just shout out a question, anybody.
Some good questions there. It's great.
Yeah, no, yeah. Hopefully I've tried to answer them as best as I can.
No, it's good. It was good. One question that I have, Rita, why would you use filler or SuneKOS, like the difference between them? Because obviously you'll get a lot of patients in your clinic asking you to have tear trough filler. Do you have like cases where you actually recommend the SuneKOS instead of like a cross-linked filler?
Yeah, I do. Yeah, so patients, you know, because of the reading that they do online, they automatically assume that tear trough filler is a holy grail and it answers all their questions. It sorts out all their concerns. So I've had patients come in and they have very obvious pigmentation issues rather than any hollowing. And then they ask for teardrop filler, and they're almost disappointed when I say to them, teardrop filler isn't going to sort it out. It's only going to give you a little bit of an improvement, but not that much. And you'd be far better suited to go for SuneKOS instead. And once you start talking about the science behind the product and the rationale behind it, and you win the patient over onto your side, and I think that's when they start to believe in the treatment plan that you've then suggested to them. So it's all about just explaining and telling the patient the reasons as to why you're suggesting treatment plans to them, and why one treatment isn't suitable for them. So yeah.
Brilliant, thank you.
Shall I start my video now? Kate, are you on video?
Yeah, I can go back on, that's fine.
Sorry, I'm being really antisocial. Like, take me off the video. Any other questions, guys?
Yeah, so if anyone has any more questions or think of any questions after the webinar's finished, please either email myself or the office and we can get answers to you. I can put my email address in the chat if you need to get in touch with me for anything. I think we've just got another one on there, Rita, a couple more. Ooh. Yeah, we've got 2 more on there.
Oh, okay. Injection technique around the eyes, 90 degrees and thread. Injection technique around the eyes, 90 degrees and thread. No, so the injection technique around the eyes is you make sure you stay as much as possible outside the orbital rim, so staying sort of on the bony support rather than the soft eye socket area. So the needle is very close to the skin, it's very parallel to the skin, so needle is very, very shallow. You then pop the needle in, and because you're very shallow, less of that needle needs to go in. So you want to sort of raise a little bit of a bleb. And when you're injecting with a 1 ml needle, it's probably advisable to use a Luolock 1 ml syringe when you're first starting out. Otherwise, you might get an explosion of the product as you're injecting because of the resistance of the skin. So Luolock, and then once you do that, you can have a look at the 1 ml. It will be very easy to have a look at 0.03 ml, and you do that per bolus. So roughly about, you're sort of using 1 ml per side. So however many boluses you need to do to then use up roughly about 1 ml. In somebody who's more prone to swelling around the eye area, you might want to use a little bit less than the sort of recommended 1 ml per side, and just play it by ear. Does that answer your question about the injection technique around the eyes? So it's not thread. The tip of the needle is stationary, and then you inject the 0.03. So you're raising a bleb in the skin. What's the process of training on SuneKOS? Oh, well, that's where Kate is an expert. She'll tell you exactly what's needed.
Not sure about an expert, but yeah. Yeah, so we have quite a few different, we've got a couple of options for training now, which is great. So we have official training with them, our partners, which is Angel Academy. So this is official SuneKOS training through MedEffects. And they do a day's training, which is all certified, and you can use that for your insurance. That's like a day's training where you go through all the different SuneKOS products. So it starts from Performa 1200, you go through Cell and Body. And so that's a full day. If you have had training before, or you're quite a very experienced injector and you just want to come along to a workshop, we actually do workshops every month in different areas of the country. So we have, at the moment, we have them in London once a month, and then Derby and Leeds. So we kind of cover the whole of the UK. So if anyone does want more information on training and workshops, please send me an email. I have put my email address in the chat. And there's also the account manager email as well. So please just send us an email and we can get back to you with like dates and how that works and everything. That's great. Fab. So yeah, that's answered one of the things I was just about to say anyway. So that's good. Has anyone got any more questions while Rita's still here?
They're asking for a replay link. I think it's going to get uploaded onto the YouTube. Oh, thanks, guys. I thought I was boring you all then.
No. So yes, this will be available on YouTube as well after today, so you can look back if you want to recap on anything. You'll also receive an email tomorrow. Anyone that's attended the webinar today, gets a code. So if you wanting to try any of the SuneKOS, or you're already using it and you need to put an order in, there is a 20% discount on the SuneKOS products. So you will get that email through tomorrow with the code and everything as well. So that's quite a nice little Christmas discount, which is quite good.
Somebody's just put their hand up, but the name's disappeared. It began with M. I'm so sorry. Did somebody just put their hand up?
So we just had some more comments. Great presentation. Well done, Rita. Thanks, Meti. And then can we access the chat? Could you please read out your email? Okay, can you not see our chat? That's fine. So what I can do, yeah, so it's katie.harris, and that's at ddgroup.com. So if you can get that. If not, then just give head office a ring at MedEffects and they'll be able to give you my contact as well. So any kind of questions on anything regarding training or marketing support, or just general support, then you can get in touch with myself or just call a head office to get more information. It's quite good because we're doing a lot of work behind the scenes at MedEffects with the SuneKOS brand. So we're going to have soon a marketing portal that you'll, if you're a customer of ours and you're buying SuneKOS already, or if you start buying SuneKOS, you will actually get a marketing portal available for you. So that'll have everything on there that you need from marketing, social media posts, before and afters. All the webinars will be on there. Also, all like consent forms and things like that. So everything will be put on one portal that's like imminent, it's nearly ready. So hopefully in the next couple of weeks, you'll get an email about that as well.
I think Melinda's asked something. So if we have some product left, can we keep it or must it be thrown away? Somebody asked this at the workshop, isn't it? And I said, well, I tend to just use all of it because it's 3.5 ml. Usually patients have areas that they want treating. Like, for example, you can treat their face, you can then use the rest of the products on their neck. And they're paying for the one vial. I don't know whether anybody charges per area. I think that's how it means, but like, you know, you can just charge per vial. So I personally only charge about £160 for a vial of SuneKOS Performa. SuneKOS 1200 is a bit more expensive. But yeah, so in terms of throwing the product away, I just use it all in one go in that treatment session, and I don't keep anything. But Kate, do you know what the official line is on that?
Sorry, what was that? Sorry, I was typing out my email when you were saying that.
Oh, sorry, no, just if we have some product left over, can we keep it or must it be thrown away? Like, for example, can we keep it in the fridge like Botox?
Yeah, so we do recommend you use the whole product in one. From professional dietetics, they do say use it all up at once if you can, whether some people do or not. But yes, it is best that you use it all for one treatment. And like Rita was saying, you can use it in different areas of concern. So if you're just using it for the eyes, you can just use the rest of the product on areas of concern, just for, you know, overall texture of the skin and glow and hydration as well.
On their neck, on their hands, on their décolleté, you've got so many places you can use it, guys. Yeah. So, you know, the patient kind of feels like you've added value for them as well. If you use the whole vial and you don't just, you know, inevitably patients are going to have more than one problem area, so they'll be more than happy usually in most cases to have another area treated.
That's great. I'm just trying to for some reason no one can see the chat, so I'm just sending you my emails individually so you've got it. That's great. Don't think there's any more. Oh, there's one more question here about 1200 at the bottom from Melinda. Rita.
I find it too much sometimes, especially when I use with 1200. Yeah, I suppose 3.5 ml is a lot, isn't it? But rather that than the other way, and just have like one little mil to play around with, and then before you know it's all gone and you haven't even finished treating the problem area.
Yeah, they're not stingy.
Yeah, exactly.
All good.
And the patient feels that they've had value for money as well.
Yeah, exactly. That's good. Fab. Okay, well, that is great. Thank you so much, Rita. That was brilliant. That's a really good presentation. Thank you.
Thank you.
And thank you for everyone that's joined this evening. I know it's late. I know it's getting close to Christmas as well. So I really thank you all for joining us, and I hope you found it useful. And I want to wish you all a Merry, Merry Christmas as well. So have a great Christmas.
Take care, guys. Bye.
Thank you.